Ken is back. Okay, we're back. Hello guys. Magandang gabi po. Good evening.
Oh yeah, good
Good
evening.
evening. COVID
evening,
revenge
Revengers.
again. COVID revenge.
Na-miss ko kayo in fairness.
Oo, actually nakakamiss, no? Vince again here. Sir
Joel.
Roma.
Jordan here on a very gloomy evening with
Yeah.
our Typhoon Ophel.
and our young blood, of course.
Clark.
Yeah, we're complete. So mamaya
Si
meron
Roma.
tayong special surprise guest. So mamaya na siya. Okay?
Yeah.
So, ayun. So, kamusta kayo? Kamusta kayo? Na-miss ko kayo ng san linggo, ah.
Oh,
Yeah, so, anong balita? Anong
Another week,
balita?
another week.
What happened? Ako, may masaya akong kukwento mamaya. Sige, ako na yung huli. Kayo na muna.
Oo, ang bilis nga ng panahon eh.
Sobrang bilis. Sobrang bilis. Yeah. Ikaw na muna.
Sige.
Sige.
Ulit ang lumipas.
The rose among the thorns with the red lips and red headphones. Kamusta ka, Roms?
Okay naman. Nothing really exciting like for the past 7 months.
Mhm.
Siguro more on reflection lang din on what's been happening. But basically, thriving, trying to survive. Yun.
Yeah. Hang on there. Hope lang. Diba?
Yes.
Stay hopeful and kaya natin yan. Kaya natin yan. Yeah. Primo. Kamusta ka, Primo? Mukhang galing ka pang meeting, ha? Mukhang...
Oo. Pinutol nyo naman yung usapan ninyo, naiiyak na ako.
Oo.
Walang iyakan dito, tawa na lang, di ba? To have fun, seriously nga eh.
may panahon kasi, nanonood ako ng YouTube, ganyan. Pinapanood ko yung mga audition sa X Factor, American Idol, The Voice, yung mga ganyan. Yung mga emotional, nagkaroon ng time, yung mga napanood ko yung mga emotional auditions.
Moments, yeah.
Yung mga mga moments na golden buzzers. Nagkaroon ng time, nakakaiyak yung iba.
Actually, no?
Umiyak ko.
Yeah.
Yung iyak naman na nakakatawa, lalo na pagka Pilipino.
Correct.
Yung The Fourth Power ba yun? Yung mga babae na Filipinos na sumali sa Britain's Got Talent. Nakakatawa. Nakakatawa. Britain's Got Talent ba yun? Britain X Factor yata. Parang ganyan. Nakakaaliw, tas maiiyak ka. Kasi nagkaroon din ng time, nanood kami, buong pamilya naman, yung mga musical na movies. Katulad nung, nag-marathon kami, yung The Greatest Showman. Tapos sinunod namin, pati yung Moulin Rouge, yung mga ganun.
Galing, no? Nakakatawa. Wait, may tanong ako. May request ako, Primo. Tayo ka nga. Mukhang naka-brief ka lang dyan.
Nakakuot lang.
Actually, nakatayo na ako.
Magalamig ba dyan? Malamig yata dyan sa Switzerland.
Malamig nga dito. Iba na dito, no? You know?
You know? Ikaw naman, Sir Jordan, how are you for the past week? Kamusta?
Okay naman. And our special guest for tonight is on her way home, still inside her vehicle. And soon to go over inside their subdivision. So she'll be able to join us in about 15 minutes.
Okay.
But one of the reasons why we invited her is kasi siya ay isang infectious disease specialist.
Correct.
Sabi nga nila yung mga infectious disease specialist daw ang mga nangunguna ngayon sa pag-aaral
sila ang importante ngayon.
Yes.
ng ating COVID.
They're heroes.
Of course, sabi ko kanina, we are of course expecting the many landfalls of the Typhoon Ophel. And marami nagulat the other day. Diba? The other day, ang lakas ng mga ulan at marami na naman mga sakyan ng inabot ng baha.
Correct. Yeah, kawawa, no? Kawawa.
I think we forgot to clean out our drainages during the lockdown.
Again, oo.
Pero ang grabe naman talaga, ang lakas naman talaga ng ulan.
Ng ulan.
But
Yung
what's good about
outpour,
it is, what's good about it is medyo maiksi lang ang torrential rains.
Yeah.
Napapakanta ka na la 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 la
Yeah.
la 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 la.
Oo. Ina-intelligent na yan.
Yeah. And we have been observing the normalcy, a semblance of normalcy when we go outside. When you go into the mall, marami ng tao. Sa karsada, marami ng mga sakyan. At mukhang ang mga tao ay nagiging confident na lumabas. No?
Correct.
Siguro brought about by some improvements in our infection rate. No?
Correct.
So, ang sabi nga ng iba mukhang magiging busy ang Pasko. At marami pa rin na magsha-shopping sa labas.
Kasi yun sa tradition na talaga yan. Wala nang...
So, there was one time na nakalabas ako sa mall and nakakausap ko yung mga nagtitinda.
Kamusta sila?
Malakas ang benta ng mga gumagawa ng mga t-shirt ng mga champion ng mga
Ayun!
The
best! Yes!
Sino ba nanalo?
Lakers, of course! Sino ba ba?
Hindi Lakers, si Lebron.
MVP.
Sabi ng isang
Lebron.
Yung gumagawa ng t-shirt, yung mga tatak-tatak ng t-shirt, sabi niya kung hindi nag-champion yung Lakers, hindi daw siya makakabawi. Baon na daw siya sa utang sa upay.
Buti na lang.
Actually, magiging collector's item yun sa eBay eventually. Pag may gano'n tapos yung nag-champion. Pwede yan eh. Meron yan. Pwede pa rin yun. Okay.
Lalo na pag nagkamali ka ng print. Yung print mo yung natalo.
After 5 years, 10 years, meron yan. May value yan sa eBay. Ikaw naman, Clark. Kamusta ka?
Okay lang. Same.
What's new?
Wala nga eh. Same thing. Different day, different week.
Yeah.
Video games din, gym. Wala. Same lang.
Galing-galing mo nga. Tuloy mo yan, anak. So
pero bago haircut. Saan yan?
Yes.
So, home
service.
Home service?
Home service.
Kailangan
kung nagpapa-home service kayo, naka-PPE, hindi naman na.
Hindi.
The usual mask and face shield.
Face shield.
Okay. Pero bago daw pumasok ng garahe, kailangan magpa-swab.
Tsaka sprayan ng alcohol.
Yan
yung
of course.
Yan yung mga itatanong natin dun sa ating
ang perfect.
Perfect na resource person. Yan.
Very special.
Very special sa akin yung guest natin.
Correct.
Because I know the guest. Because I don't know the guest. Kasi
very special siya.
Pero very special kasi yun. Dahil pinagdaanan ko rin yan
diba? I know.
At ang maganda pa dito, yung doktor na tumitingin sa akin, teleconsult nga. Kaya nga, yan nga isa sa mga itatanong ko sa guest natin Yun. Infectious disease doctor yung guest natin. Pero ang tumulong sa akin, ang tumingin sa akin nung may COVID ako isang ophthalmologist.
Pero kagandahan naman nun, sigurado namang malinaw yung mata niya.
Yun nga kasi
ito pa actually, ito mas matindi. Ophthalmologist siya, pero kaya niya ako tinatawagan dahil gusto niyang pakinggan yung paghinga ko. Sana ENT
through the phone, no? Dapat sa video kasi diba,
video talaga.
Ang tanong diyan, di ba? Pag tinitingnan ka,
Viber.
Pag ang doktor ba tinitingnan ka, nakatingin talaga ba sa'yo? Papatingin ka sa doktor, so titingin lang ba siya sa'yo?
At tingin sa dibdib.
Yan.
Siya
titingin. Paano umaangat yung dibdib. Sabi, buksan mo nga yung polo mo, tingnan ko nga yung pag-angat ng dibdib.
Pwede.
Ano ba yun? Babae ba yun?
Lalaki.
Lalaki.
Patay tayo dyan.
Okay. Sa akin naman, it's a very happy and very exciting, di ba, yung week na nangyari before yung middle of the week hanggang matapos yung linggo. Because of the championship, of course. Di ba? God. And, di ba, challenging siyempre sila in the bubble, di ba? Although maraming siyempre mga sides na, di ba, mga commentaries na it's easy in the bubble, it's hard in the bubble, di ba? At the end of the day, it's still a W. It's still a win, di ba?
Yeah, but what's noticeable is yung mga bata, yung mga 20 years old na mga player.
Yes.
Saka yung isa, undrafted pa yung isa. yung 3-point shooter ng Miami.
And I salute to Miami.
Oo,
Sabi si Spo. Pinoy yan. Ang galing nila. Ang galing nila. Ang galing ng puso. Ang galing ng
Hindi ko na-contact si Coach po kasi busy daw siya. Medyo lumuluha pa yata.
Oo nga. Nawalo nga. Pero ang galing naman.
Pero mo, player pa ni Spo dati si di ba? Si LeBron.
LeBron.
Nag-champion ng Miami.
Pero so, contender yan for next year.
Oo.
Galing. Maganda yan.
Pero, actually, surprising nga pareho. Pero, pati naman yung Lakers hindi naman sila ganun kaangat talaga during the season. Parang humabol lang talaga sila.
They are number one.
Number one sila.
Sila ba? Number one?
They're number one.
But when was the last time that they had a championship?
I stand corrected.
10 years ago?
10 years ago.
Nandun si LeBron.
Kobe pa yun.
Si Kobe.
Si Kobe pa.
A decade ago.
Pero what's admirable about that tournament is yung natapos nila yung liga nang walang naging problema sa COVID.
Correct. Walang positive, di ba?
Galing ng organization talaga.
Galing nila.
Naku, sorry, mali pala ako. Last year pala yung medyo hindi okay yung Lakers, di ba?
Yes. Injured kasi siya.
Sorry.
He got injured kasi with a groin injury. So yun, that's one of my mga parang positive week, positive moment. Isa pa rin na first time namin lumabas ni Clark last Monday kasi nagpunta kami Libis at service ng kotse. It's a positive way, it's a positive outlook and positive experience because ang dami na talagang tao sa labas. So feeling mo na nagno-normalize na. 'Di ba? In a way may scare din na gusto ko ring kay Doc sa ating guest mamaya na is it parang carelessness ba ang pwedeng mangyari na baka naman mag-second wave? Yung mga ganong tanong di ba? Baka kailangan open yung economy. So, di ba? Pero
actually,
positive way na lumalabas na yung tao, mag-normalize. Kasi normal is traffic na kasi. Kaya normal di ba? So, ang traffic na talaga, which is...
Ako kasi para sa akin kasi yes, carelessness Kasi yun yung dapat nating iwasan. Kasi sa totoo lang, yung virus kasi, madali talaga siyang iwasan Wag lang tayo talaga maging complacent. Wag yung tipo bang papakasiguro tayo, akala natin okay na tayo, akala natin malinis na tayo.
Correct.
Hindi na tayo nakakapaghugas ng kamay, hindi na tayo nakakapag-alcohol. Akala kasi natin, ang lapit lang ng bahay, di ba? Or akala natin, nandun tayo sa safe na lugar. Dapat talagang, let us not trust too much on our surroundings.
And coming from you, Primo. And coming from you guys, diba? Viewers, si Primo is a survivor of COVID.
Yeah.
So yan. So coming from him, it really means a lot, diba? Na talagang don't put your guards down kahit maraming tao.
Correct.
Yun nga, yun ang pwedeng mangyari kasi with this. Nakakatakot lang with the holiday season coming in, diba? Baka medyo makampanting ka na, dami ng tao, normal na, makalimutan mo mag-alcohol or, diba? So, mas maganda nga na, diba? Coming from Primo na.
Malling. Naku, medyo nakakaano pa rin yan.
Ang maganda na kasi sa tao, we are creatures of habits
Correct.
Kailangan lang
ma-develop yung habits.
Ma-develop yung habits natin. Dahil, kagaya nangyari kay Primo, baka hindi naiisip ng ibang mga tao yung shinare niya the other day na ang dami pang side effects na iniiwan ng
yun.
Ang dami pa.
Yung din natin mamaya kay Doc yan. Yes.
Experiences.
Marami pa dyan. Nararamdaman ko pa hanggang ngayon.
Actually, 98 symptoms after COVID. Diba? So yan, din natin kay Doc yan.
Parang top 98 pa nga to sana
So top 98, 'di ba?
Yun ang
yun ang nakakatakot, 'di ba? Na tipo people have to know.
Yeah, and then there's also the news that there are some developers of the vaccine that pulled out already kasi matindi yung mga side effects, no?
Side effects, yeah.
Ayun, 'di ba?
And while we are pushing for the vaccination trials for the 12 and below, alam ko nasa 12 and below na sila hindi pa na-perfect yung nasa middle age and then nasa 12 and below. And I think it's going to be coming in the Philippines yung trial by this month I think that's stage 3 and stage 4. So,
na human trials, no?
Na human trials. Kung karera ng 12 dati, parang nabawasan na naman siya ng 2. Ang dalawa.
Hindi talaga ganun kasimple. Lalong-lalo pa kung lahat nagmamadali. Dahil dumarami ang nagkakaroon ng sakit at dumarami din yung mga namamatay. So yung iba din na gumagawa, iba ka masyadong in haste sa development. So kaya yun, nagpo-pull out dahil siyempre, parang babalik ka ulit yung back to zero ka eh. Hindi mo alam kung saan ka nagkamali, anong steps ka nagkamali.
Correct. And you don't have to gamble with life kasi human life yung, di ba, at risk.
And they also have to cut losses, di ba?
Correct.
Baka hindi rin nila makuha. Mapapagastos lang sila lalo. Kasi ang development na niya, hindi biro Hindi biro ang development ng vaccine. Lalo na with such a big scale as COVID-19. Hindi biro yung hindi biro yung
they have to test pa din yung mga side effects nun eh. Hindi naman
correct. Yeah.
Actually, 6 months nga supposed to be after the trial. 6 months doon pa lang maglalabasan yung mga medyo minimal side effects na lang, hindi naman yung medyo matitinding side effects. But of course, you have to look at paano yung mga nagdadalang tao. Correct. Kasi yan ang mahirap kasi dahil hindi mo naman masusukat yon dahil yung pagbubuntis, hindi naman yan 3 months, 6 months, 9 months yung pagbubuntis eh. So pag nanganak yun after the trial, 9 months doon mo palang makikita kung anong naging effect doon sa ipinanganak niya o sa pagbubuntis niya, di ba?
Yeah. And baby rin, di ba?
We also have to remember, ganun kabata kasi ang COVID.
Yeah, totoo yan.
Pag isang taon pa lang halos.
This virus,
COVID-19,
this strain,
COVID-19.
Correct.
Napakabata lang niya para makasiguro tayo kung ano ba to? Para ba tong flu na nandyan na yan sa'yo? And yet may antibodies ka na. Tandaan niyo, ang flu, kahit na nandyan na, meron ka ng flu virus. Maya't maya ka pa rin, lalagnatin, kasuhin ka pa rin, di ba? So, ganun din ba ang COVID-19? Kasi, ang COVID-19, wala pang isang taon halos di ba?
Yeah,
isang taon pa lang talaga siya.
And it can mutate, di ba? It can mutate, di ba?
It has mutated already. It has mutated already. Ano na nga siya, 2 strains na siya. Ganun nakatindi yung mutation.
Grabe.
And sabi pa kanila, baka nga hindi lang 2 strains. So, paano mo anuhin yun ngayon, di ba? Yung lahat ng strains na yun. Ang kailangan mo nun, siguro, kailangan mo maghanap ng parang tinatawag natin sa math, the common denominator. Yun yung mo. Yun yung i-inoculate mo.
Correct.
Tapos
ano bang Wikipedia nung inoculate?
Ano ba yung oculate?
Inoculation kasi is the process
of... Bigat
i-process kasi yun of
oculate.
Bleed
Oo nga, oculate. Pisay kasi yan eh.
Hindi na, sorry.
Pisay kasi yan eh.
Pero yun yung mo. Ewan ko, tama ka, makamali. Anyway, taga to. Yun kasi yung mo, taga to. I-oculation kasi.
Inoculation.
Kailangan mo kasing
lumalalim na. I want to touch on the topic of the reopening of businesses. Yan. Kung pwede natin pag-usapan. Because we are into the celebration of Restaurant Week. So,
may ganon? Meron pa lang.
Sino Wikipedia naman yan, Sir George?
Worldwide yan, worldwide.
Talaga? Hindi natin alam yun, guys, ha?
Kaya
mag-buffet na tayo. Let's go.
Kaya yung VRC Food Park nag-open na ng restaurant Ang physical restaurant.
Saka
alam mo?
Ang special guest ba natin isang restaurateur?
Pero makakatulong siya pagdating doon sa mga pumapasok sa restaurant. Kasi imagine mo, the government, it started in, nagsimula lang sa Maynila 2 weeks ago And then Quezon City will be having its restaurant week in the coming 2 weeks, no? Ang pinag-uusapan doon, how are you going to be able to get the customers to go in the restaurants and be confident to stay in the restaurant and spend money, no?
Yes.
At gusto ko rin i-share kasi nung nag-open kami ng restaurant, ang dami palang gastos ng pag-reopen. Alam mo, nag-inventaryo kami ng mga ingredients, yung mga stock. Grabe, almost 90% expired na ang mga stocks. Tapos, when you open the appliances, unang-una, yung mga ilaw, ang daming mga pundido, ang daming mong papalitan, ang daming aayusin. So it's almost 2 weeks of hell.
Okay.
Para ka rin dinaanan ng...
Maliit na negosyo lang yun, ha?
Yeah.
Paano pa
grabe,
kaya
no?
yung mga
Oo.
Mabigat ang gastos. So, imaginein mo yung mga, madami yan. Mga hotels, mga restaurants na malalaki. Ibig
fine
sabihin, hindi
dining.
pala ganun kadali ang mag-reopen. Talagang magre-reinvest ka ulit.
Correct. Oo. Kasi
Diba?
nga yung mga bago.
Hindi pa kasama dyan yung hindi pa kasama din mga protocols like you would have to have your disinfection mat, you would have to have your scanner, your alcohol, your etc. Ang dami pa rin gastos. And imagine if you're a business na bumagsak ka, tapos you want to recover, tapos mamumuhunan ka na naman ulit. Ang bigat din.
Kaya yung iba decided to just really close it down na lang. Kasi
meron you have to cut your losses You have to cut your losses. Yeah.
Meron.
It's a business decision talaga, 'di ba? Which is sad, pero 'di ba? There's always 'di ba, na happy part or light at the end of the tunnel na di-discuss. Our guest is knocking na on the door. So
It's
knocking na. Knock, makatok na siya. So yun, dagdag ko lang din na one of my positive experiences this week, no? Nasalamat sa Diyos, buti naman na among my family and friends, wala namang tinamaan ng virus now. So that's a blessing, 'di ba? That's
This
a
week,
blessing
you mean, this week,
'di ba? Kasi yun nagbibilang, nag-aabang kasi
every week,
2 weeks ago, ilan yung tinamaan? 2, merong tragedy pa na, alam mo yun, it's really heavy. Pero now, yun nga, every week, every day counts. Every day counts, di ba? Kaya it's still a blessing na you're still healthy. So, yan, going there. So, sa segue na tayo na andyan na si Doc, papasukin na natin. Okay? And
Doc,
Jordan,
pasok!
Good evening, everybody.
Yes.
Tonight,
we have a guest tonight.
Alright.
It's a special day, special episode because we have a special guest here.
Yes. Doc, ba't ngayon ka lang dumating sa buhay ko, Doc?
And Doc, you have a very unique name. Tama ba? How to pronounce it? Charmian? Paano ba?
Charmian.
Okay.
So,
Charm na lang.
Charm na lang.
Ano si Doc?
Sige, charm us. Dr. Charm Hufano. Sige, Sir Jordan.
Yes.
We invited Dr. Hufano because she is a infectious, and we know for a fact sila ang nangunguna ngayon sa laban versus COVID. And of course, while we are very interested in knowing kung ano ba ang nangyayari na presently in our surroundings, I would like to give it away to Dr. Hufano to brief us our current state. Ang ating topic today is wellness amid COVID. Take it away, Doc.
Yes.
Okay.
Welcome, Doc.
Welcome, Doc.
COVID revenge.
Meeting you this evening. I'll introduce myself.
Yes, please.
I'm Dr. Charm Hufano. I am an infectious disease specialist. So my training was after med school was into adult medicine, and after which I went into fellowship for infectious diseases. It includes tropical diseases, the routine diseases that we see in the hospital and in the community setting. And well, recently, majority of my time is actually spent on treating COVID patients.
Okay. Salamat, Doc. Salamat. You're a hero.
Thank you so much.
Salamat sa sakripisyo nyo.
Ngayon pala, palakpakan na natin.
Palakpakan natin si Doc. Palakpakan natin si Doc.
Doc.
Salamat. Saludo kami sa iyo, Doc.
Ngayon pa lang, Doc, sasabi ko bayani ka.
Correct. Ang mga bagong bayani. Yan ang mga bagong bayani na. Alright.
Hindi si Agbayani, ha?
Hindi, iba yun. So, kamusta ka, Doc? So, how are you? How are you today? How's your...
Well, it's still a busy pa rin siya, no? We still remain very busy taking care of COVID patients. But if I compare my experience last March to now, no, we know much more about the virus.
That's good.
That's good.
More about how it goes, what you use for treatment. So we have more confidence in dealing with our
Wow,
patients.
that's
So
good.
the
That's good.
outcomes are actually also much better if you compare it when it first started in March.
Ang sarap nun, di ba, na
Ah,
nakakakampante na tipong, di ba? Na
But
you're,
may
oo nga.
improvement. There's
correct, may
improvement.
Oh,
improvement.
yeah.
Eh, yun naman talaga yun as we go along, di ba? Dapat
Dok, ano yung
talaga,
difference? Ano yung difference nung March at saka yung ngayon?
yes.
Pati doon sa treatments. If you
Okay.
don't mind me asking about.
So number one was everyone was so scared and
On the onset.
patients because we started with very little knowledge on how to protect ourselves, number one. So that's one thing. But now we know that all the measures that we actually implemented in March works. No? So if we actually just maintain the social distancing, use the proper PPE and decontaminate afterwards, we are able to protect ourselves. No? So that's one, that's very different. Number two, not just us healthcare workers, our patients already know how to protect themselves. So less yung chances na nagkakaroon din sila ng sakit. So less patients actually are getting admitted in the hospital.
Wow.
Oh,
So
that's
malaki
good
ba yung
news.
difference, Doc, since March talaga nabawasan?
Nararamdaman mo talaga.
Significant yung
And number
improvement.
three,
That's good.
all the measures and the treatment that we were actually giving in March was based on information for similar coronaviruses, but not really on COVID because
Bago.
it's a novel virus. So we had very little information. So the medicines that we were actually giving no March are not the same medicines that we are giving recently.
Yeah.
Talaga?
Yes.
Wow. So if the virus parang nagmutate siya, tama?
Not really nag-mutate, but now we
But
know
we better now what we know.
now we know
if you don't mind me asking, Doc, ano na po yung mga medicines and treatments na
opo. So now we have antiviral drugs that we give for patients with severe COVID. So it's called remdesivir. Yes, and there's really data that it helps decrease the duration of the infection ng mga pasyente. Pero it only helps if the infection is severe. So we also look into which patients would benefit from it. We also know now that steroids for patients who are oxygen requiring actually helps them. So it decreases the inflammation. Back then in March, we didn't know that. So we weren't using steroids for patients with COVID then that were oxygen requiring. But now it's just part of the protocol. So now medyo mas maganda protocolized na yung how we treat our patients, and there's information na that what helps and what does not help.
Yan din ba yung sinasabi na treatment na ginamit ni President Donald Trump?
I think
not
a cocktail of drugs, pero parang he did get remdesivir, but he also got parang an antibody, some sort of antibody cocktail that is not yet available locally, and it's not yet FDA approved. So,
kasi nag-steroids din daw siya, Doc eh.
Yeah, Pero aside from, so he got remdesivir, steroids, and then he got the cocktail.
And then the cocktail,
So we can safely say that we have faster recovery and lesser fatality now.
Yes.
Oh,
Doc,
that's good.
That's good.
Is it still true about yung sa age group ng mga affected? Like, yung mga older people pa rin ba yung mas mataas yung infection? Or meron na rin mga babies or mga bata now? Teenagers?
Well, actually, yung information na alam natin back then is quite similar. The patients who are at the extremes of age, especially the elderly patients, are really at risk for more severe infections. So, and patients with other illnesses. So, kunwari, may heart disease, may lung disease na dati.
Pre-existing conditions.
Yeah, Pero, go ahead.
Ay, sorry po, Doc. Doc, actually, sa totoo lang, ang dami doon sa mga tinatawag nating comorbidities. Meron ako eh. I'm diabetic. I'm hypertensive. I'm asthmatic. You know? Taga to, palang feeling ko, syempre, aside from prayers talaga, na in-offer ng mga kaibigan at saka relatives natin para doon sa kagalingan against tong virus na meron ako, no? malaki bang tulong nung pneumococcal vaccine?
Okay.
Kasi feeling ko, kaya siguro nagka-pneumonia ako, pero hindi ganun ka-severe. Nagkaroon ako, siguro dahil nagkaroon ako shortness of breath, di ba? At bumababa yung aking O2 sats.
Okay.
Pero tingin ko, nakinaya ko yon because when I got the COVID in August, but bandang June, I had the pneumococcal vaccine.
Okay.
Did that help po ba? In his
Yeah, yes, I agree. So yung pneumococcal vaccine actually prevents the most common bacteria that causes your what you call community-acquired pneumonia, yung pneumonia na nakukuha natin in the community setting. So one risk if you get COVID is if you get also a co-infection. So may virus ka na infection secondary to the COVID, tapos lalo pang sasama kung magkakaroon pa siya ng kasamang bacterial infection. No? So that was a smart move for you, and that's actually recommended that we get the pneumococcal vaccine and the influenza vaccine para we prevent all those other things that can complicate the course of COVID.
Yeah, I had that too eh. Actually, yung una nga flu vaccine eh. Tapos and then we thought about it. Sabi ko, nga pala, kailangan din pala natin ng pneumococcal vaccine. So anti-pneumonia rin kami, buong family. So and yun, ang inaano ko yun, kumbaga parang ina-advocate ko yun.
Yeah.
Like sa office namin, we procured those vaccines. Sabi ko, magpa-sign up kayo kasi malaking bagay yun.
Malaking bagay. It does really help na, Doc. Talagang...
Yes,
especially for patients with other comorbidities. So kung meron ka ng mga ibang risk factors for COVID, all the more that you are the target group actually for the vaccination.
Lalo na yung hika. Yung hika, asthma yan, ano? Mami Roms, yan.
Oh, yes.
Edad na, may heart disease, kidney disease, liver disease, all those will make you at risk for the severe type of COVID. So you really want to try to minimize everything else that can complicate it.
Yeah, meron ako noon. May yung mga fatty liver, ganyan, di ba? Fatty liver.
Which brings us which brings us to our topic na wellness amid COVID. Kasi alam naman natin na with the lockdowns, dyan na yung mga hindi tayo nakapag-exercise, masarap kumain.
Yes.
And we have all these kinds of probably diseases na nag-worsen. Wellness amid COVID, safe ba na pumunta na sa ospital, bumalik sa ospital para magkaroon ng let's say operation or treatment?
Okay, sige.
Magpatuli, ganyan.
For urgent procedures, wala naman talagang choice doon, diba? If it's we're talking about, let's talk about first, medical problem.
Correct.
Yeah.
So, the hospitals have actually learned how to deal with COVID and at the same time, make measures to help our patients who are non-COVID patients have the hospital services available. No? So one thing that's practiced right now in the hospitals is what we call telemedicine.
Teleconsult.
Yes, with your attending without actually leaving the hospital, the comforts of home.
Yeah.
Then they can already give an initial assessment if they do need to see you. And if they do need to see you, there are already checks in place when you go to the hospital to make sure that you are safe and that the doctor is safe. No? So para siyang talagang it evolved from March na it was a total lockdown. No other patients were being entertained in the hospital. So now we know how to screen the patients who need to be admitted. And then now we are also screening patients who are coming in for their checkups, who are coming in for their lab tests. So to make the environment safer for our non-COVID patients. And marami na ring innovations such as a lot of hospitals have started operating mga drive-through laboratories.
Correct.
Service then.
Yes.
Home service.
Vaccination, home service, vaccination, home service, physical therapy. So parang all these are innovations to help. Siyempre, kasi majority naman ng mga pasyente natin before this COVID season was, those medical patients and surgical patients who have no COVID. No? So, we also need to address their needs. So, yun yung parang from the March period that we were just trying to see how to deal with COVID, now we have shifted our attention on how do we make sure that our non-COVID patients are also get access to health services also.
Right. New normal. Yeah. Those yung mga nagdadialysis.
Yeah.
Yes.
Actually, Doc, nung nagkasakit nga ako, siyempre, walang doktor na tumingin sa akin na physical face-to-face, di ba? Kaya ako, I advocate also yung teleconsulting eh. Because, pinakinggan yung hininga ko, tinignan niya ako, video conference lang kami, or video call, kasi dalawa lang pala kami, so hindi conference. So yun, talaga dalawa lang kami. Ayun pala, pinakikinggan nila ako, actually, dalawang doctors yung tumawag sa akin. Yung isa, nagka-COVID, nagka-COVID din. One of the doctors na, well, anyway, close ko yon. And then, dahil siyempre, patient din siya, so hindi ako na nagpaano sa kanya. Meron isa, yun yung nag-teleconsult sa akin. And, pwede ko sabihin na siya talagang tumingin sa akin kasi ophthalmologist siya.
Oo. So, nakatingin talaga siya, Doc.
Dapat siya tumingin. Pero,
Yeah.
siyempre, alam naman natin na all doctors, you were first general practitioners, di ba? Kasi, kaya and dahil sabi nga, pag-usapan nga namin, dahil bago nga ang COVID, so sabi niya kung ano daw yung napag-aralan daw niya. Nag-aaral naman din siya about kahit ophthalmologist na siya. And it was good. Malaking tulong na nandaan doon siya na isang doktor. Nabigyan nga ako, ang sabi nga niya sa akin, ito yung parang gamot na ibibigay ko sa'yo, tawag ko dyan, COVID kit.
Talaga, wow.
So yun ang yun ang
COVID
ininom
kit
ko.
na.
That was apart from yung Chinese medicine. Yun pala. How ano yung effect naman ng Chinese medicine? Hindi ko na sasabihin yung brand.
Yes.
But alam nyo na yung sikat na Chinese medicine.
I wanna know the
patients.
reaction ni Doc about it. Kasi mixed reactions ata ang,
Okay.
Yes.
All right. Well, number one, it's already here in the Philippines, right? So there are some who are actually prescribing it. There are different protocols for different hospitals, and we do have we have a Society of Infectious Diseases that comes up with guidelines to help all the other clinicians treat our COVID patients. Currently, it's still not yet in the guidelines, but I do know that there are some studies in China that did say it has some value in treating mild COVID patients. But as of now, the data is not robust enough for us to include it in the guidelines.
So palang case-to-case basis pa lang,
Wala pa siyang enough information for us to put it in the protocol.
So the doctors are not yet recommending it. Like those who took it before, like take it at your own risk.
Actually, ang nagre-recommend niyan, yung mga nagkasakit at nasubukan yung medicine.
So,
katulad ko, hindi naman sa nasubukan ko rin yun. Talagang nag-init yung dibdib ko.
Okay.
And then I thought I wasn't so sure if nagkaroon din ako ng diarrhea, no?
Yeah.
I'm not so sure if that diarrhea was caused by the COVID or it was caused by the medicine. Kasi effect din daw ng medicines yun. Ay that Chinese medicine, no? And pagkatapos kasi noon, buong araw ako noon na lagi ako nasa banyo noon kahit na hinihingil ako noon, Doc, no? Pero napansin ko, gumagaan naman yung pakiramdam ko tuwing nanggagaling ako sa, literally and figuratively na gumagaan yun.
Gumagaan. Ilang balde na Kaya pala pan-diet yan, Masubukan nga yan.
Pero kaya nung may mga nagsabi sa akin na nagkasakit, sabi ko, okay din yan. However, sabi kong gano'n, tapatan mo rin dapat ng either at least tubig. Or at mas maganda kung may oresol. So yun ako lang, oresol ako ng oresol. So pagkatapos, yan, para at least hindi ako masyadong manghina. Kasi as it is, may sakit ako, magbanyo lang ako, mag-toothbrush ako, Nanghihina na ako, hindi hingal na ako.
Gano'n na talaga. Even my friends din, meron akong mga friends na even by talking, they catching me friend. One sentence, talagang, they have to stop. Di ba? Meron din kaming friend ni Roms na tama rin same experience with that medicine.
Meron akong seryosong tanong kay Doc. Dahil sa sinabi mo na bumibilis ng recovery, lesser na ang fatalities at gumaganda ng treatments ng ating mga hospitals, I need a reason. Kasi mga homeowners, tapos yung mga magulang, meron mga dumarating na mga manliligaw. Ano bang magandang pagtaboy sa kanila na rason? Correct. Na, teka muna,
bawal pa eh.
Huwag muna tayong masyadong magpadalos-dalos sa pagdalaw sa mga dalaga sa bahay dahil hindi pa masyadong safe. How do we protect ourselves from COVID? Na medyo nagno-normalize na yung mga kabataan eh.
Well, maganda na kumukonte na yung cases, no? Pero more recently, we see the effect of people congregating because nakikita namin na yung mga na-admit recently, maybe in the past 1, 2, 3 months, since Father's Day actually, were people from the same family. So, meron kami mga pasyente na 4 sila sa compound, isang buong pamilya. So, yun yung nakikita namin. Some people are becoming lax with the elderly patients. Dalawa lang silang matanda sa bahay pero dumadalaw yung mga apo. Tapos kumalaw, walang mask, walang face shield. So, nagkakaroon ng sakit yung dalawang matanda. Meron din sakit yung bata pero mild din sa kanya. Hindi niya masyado, either very mild, hindi niya napansin, or asymptomatic.
Correct.
I think yun nakakatakot
Pwede ba, Dok, sabihin doon sa mga manliligaw na magpa-test muna kayo, magpakita muna kayo ng mga test niyo bago kayo umakyat ng ligaw? Kailangan ba yun, Dok?
Should we require that?
O naka-PPE ba sila bago sila pumasok dito sa bahay namin?
So, kasi we have to take into consideration, especially for the high-risk patients, yung mga lola natin, lolo natin, na gusto man natin dalawin, baka mas makakatulong na
wag na lang dalawin.
Muna. Yeah. Correct.
We have to protect them kasi, no? So, maybe it will not be much of an issue for the younger ones, but exposing our patients na our elderly patients or those with comorbidities to COVID, sobrang taas ng risk. So we still do not advocate that we have parties.
Correct. Big gatherings. That's why we have Zoom, di ba? Yan kaya may Zoom. Di ba?
Kaya kami merong inuman.
Yan.
Meron bang iligaw? Ligawan.
Iuwi muna. Yun nga, di ba?
Oo nga.
Kamusta ikaw, Doc? Do you have kids ba?
No, I don't have kids.
Okay.
And yes, I actually do not go home to my parents' house at this time. So if I do go home, I actually go through the whole process of getting myself swabbed.
Tama. Kamusta naman sila? How old are they?
Lalo ka na exposed.
Correct.
My mother is 69. So, high risk na talaga siya. Although wala na comorbidity. So, yun. Pero before I see her, I make sure that I do the...
Tama. Because you never know. We'll pray for her. Sana tuloy-tuloy yung kanyang she'll be safe. Okay, going there,
Doktora, Doktora, itong ating young blood. Merong gustong itanong yan eh. Hindi lang yan makapagpakawala ng tanong eh. Yung
Sige,
mga ganyang edad, yung mga edad namin, meron kami mga tanong eh. Sige, go Clark. Ano mga katanong mo kay Doc?
Kasi Doc, recently, nakikita ko lang na marami ng friends ko na nagbi-beach, nagmo-mall, lumalabas. So it makes me question na sobrang safe na ba or normal na bang lumabas basta naka-face shield, naka-face mask. Kasi natanong ko rin yung cousin ko na nurse. Ang sabi niya, safe naman lumabas basta like ikaw personally, alam mo yung mga dapat gawin na kunwari, mall ka. Na-mention naman ng mga friends ko rin nang galing sa mall na every shop naman merong sanitizer, alcohol, may temperature check din and everything. Tapos sila, di ka papapasukin ng mall nang hindi ka naka-face mask or face shield. So with that said, safe na bang lumabas? Kasi medyo nabobore na ako dito sa kwarto eh. Wala, naubusan na ako ng gagawin.
Tatlo pa man din ang pintuan mo dyan.
Yung younger age group na they become angsty tapos makulong lang sa bahay. So there's less cases, so that's good. So that makes the probability of you getting COVID lesser than when it started before. But for me, my advice is if it's not necessary, I would still want to make sure that I am safe. So if I didn't need to actually go to work, I would just stay home. No? If I do need to go out, buy something, mga necessities, buy food, I'll just make sure that I go to an establishment na konti yung tao, number one, na nag-check for safety, lahat ng tao naka-face shield at naka-face mask. Available everywhere yung hand hygiene, yung pang-hand hygiene. No? So, ang problem ko lang, I wouldn't recommend going to the mall and eating.
Dining out.
Dining in.
Wherein wala siyang social distancing. So that's one thing that will not be safe. If you do really need to go out and eat, maybe look for a place that has outdoor dining. So safe air exchange doon is much even higher than a negative pressure room. So it affords some sort of protection for you.
Correct.
Beach, siguro kung hindi populated, konti yung tao
private,
it's outdoor, fresh air, mataas ang air exchange. That one you can, just make sure that you're careful. Some things that maybe you can enjoy. So, especially kung hindi ka naman high risk na individual.
Yun nga.
Doc, question, yung high risk, may age gap ba yun?
Yung elderly age group, so that's one. Number two, if you have other illnesses, hypertension, diabetes, you're on steroids for other medicines, you are on chemotherapy, obesity is also a risk factor.
Aray ko. Sabi ko na eh.
Across all ages yun, Doc. Hindi lang yan elder. Across all ages.
That's also a risk factor. So those are things you take into consideration if you will venture out.
Yeah.
What are the things, kaya, Doc, that we can do or eat to boost our immunity?
Okay.
Aside from, of course, the vitamins and the
Okay. They've looked into making sure na healthy yung yung diet mo, you exercise. Ideally, if you are overweight, you lose weight, but that's harder to do right now. Pero that's one thing that could protect from COVID. Medications, they did see that patients with low zinc values and low vitamin D values were at risk for more severe types of COVID. So that's one thing you can look into your supplements if it has zinc, if it has vitamin D. Yes.
Okay.
Doc, hindi ba masyado daw, meron bang dapat limit lang of number of milligrams ng zinc per day?
I think yung routine lang na kasi the dose that is required actually is quite high, but there's not enough evidence that it's used for treatment. So what you just need to make sure is you have enough in your body. So the multivitamin that is usually available is enough for prevention.
Okay. So going there, thank you, Doc. Going there with the vitamins, to say you do this, vitamins, di ba? Exercise, ganyan. Ano ba yung mga symptoms? Does it vary? Depende sa healthy or medyo hindi nagva-vitamins or medyo, into sports and hindi naman. Ano yung mga symptoms? Does it vary ba sa tao? O talagang one symptom, yun na yun?
No. Well, it's mostly respiratory symptoms. So, cough, colds, fever, anosmia, wala kang maamoy, wala kang
malasahan.
Grabe yan. Nakaka-freak out yan, yung wala kang maamoy, as in.
Pero does it come right away? O dapat may sipon muna, ubo muna? Kasi ako may hika. May hika. So yung pag hinika ba ako, it's alarming na dapat aantayin ko na mawalan ako ng pangamoy because yun na yung talagang, oops, positive. Paano ba yung hindi?
No, there's no one profile of how it happens.
Okay.
Patients who immediately just get difficulty of breathing. There are patients who do not have symptoms actually.
Yeah.
Just get a positive result because they are screened for COVID. There are some patients who present with parang trangkaso. So hindi talaga set na program.
Walang standard na ito yung, pwede yung number 5 symptom maging first mo. Or yung number 1 maging, di ba? So, yun nga, yun na nakakatakot basically.
So,
di ba?
pag na-expose ka with somebody who has COVID, tapos nahawaan ka, gaano po katagal mag-exhibit yung symptoms sa'yo? Or is it like, the next day, pag meron na-expose ka COVID, next day, meron ka na agad symptoms? Or meron bang incubation period? Or
So, yung quarantine period natin of 14 days, if you remember, is the typical incubation period of COVID. So, that's why if you do get exposure, you count 14 days from then and monitor yourself for possible signs and symptoms.
14 days.
So, 14 days.
Yun, ganun pa rin ba now? 14 days pa rin. Kasi March, 14 days pa rin. So now, ganun pa rin talaga yung standard.
Iba na yun. Kung from March until today, lagpas 14 days na yun.
Yun nga eh. Hindi, kung ganun pa rin yung standard na quarantine na
14 days talaga.
So,
kapag na-expose ka.
Days, pero yung period or what you call incubation period, yung exposure to symptom, within 14 days. So
within 14 days.
Within
so pag wala kang symptoms ng within 14 days,
you're okay.
Okay na.
It means you're
diba?
okay.
Hindi, magpapatest ka.
Magpapatest
ka.
ka.
Yeah, of course. Yeah.
Doon naman yung asymptomatic, di ba, Doc? Tama ba? Pwede naman, okay.
Mas matindi nga din asymptomangit.
Asymptomangit. Yun, walang symptoms yun. Walang symptoms
walang gamot doon.
Okay, Doc, you're saying? Sige po.
In the hospital, what we actually do, kasi we do see a lot of patients, meron kaming parang risk stratification para masabi kung high risk yung exposure. So, kinakount doon actually was kung naka-PPE yung healthcare worker.
Yes.
At saka mask yung source. So,
Doc, sorry, follow-up question. What if, kunyari, exposing, how soon can you get tested na you'll get a positive if you're positive?
How
like,
soon?
Can you get that? Like, kahit wala kang symptom, after 3 days, pwede ka na bang tapos would it show positive already?
Or is it safe na, for example, like, lumabas ako, tapos di ko alam kung meron akong, or na-expose ako sa source. Can I get tested the day after?
Yun. Will you get positive result if you're positive or if you got the virus?
Okay. So usually the viral load is highest 2 to 3 days before you get your first symptom and the first 5 days thereafter. No. So it really depends if you become symptomatic. So what we do if what we do for healthcare workers to identify sino yung kailangan matest is we look into risk stratification. Naka-mask ba yung pasyenteng may COVID? Yun pa lang, may protection ka na nun. Basta naka-mask siya. So that's one thing. Pag naka-mask ka rin, mas mataas pa yung protection. So ibig sabihin nun, hindi na siya high-risk exposure. So ganun namin siya tinitignan para hindi naman kami lahat ng tao ay test ng test, no? Resources ng hospital. And it works. So that's what is recommended actually in the US. That's very similar to what we do here in the Philippines.
In the world. Okay.
So it's a doc question lang. Like for example, situation na, let's say, ako mag-visit ako sa friend ko, bahay ng friend ko. Tapos nagkaroon kami ng mini gathering doon. And then
Papaalam na.
Text ko si Doc. Doc, ano number mo? Payagan to.
So after lumabas, syempre hindi ko naman alam na kung sinong may COVID doon sa pinuntahan ko, diba? And hindi mo naman maiwasan magtanggal ang mask kasi syempre kakain,
we're eating, drinking,
mag-uusap, so kailangan magtanggal ang mask ko.
Ang suggestion ko sa'yo, Clark, wag na lang.
So after that gathering,
pag uwi niya, next day ba magte-test na siya or
Huwag mo nang pauwiin.
hintay siya ng
do I have to wait it out?
Either wag na pa alisin, di ba? Yun nga kasi Doc, di ba? Isa ring ng notion, okay, you can go out, pero yun nga yung sense of responsibility ng mga bata na hindi lang ikaw, pwede ka hindi maapektuhan ng grabe, pero yung uuwian mo, pwede maapektuhan ng grabe. So you have to be conscious about it, di ba? Pero with this answer Clark's question na baka pwede siyang mahababa, di ba? Sige po.
Or kailan ako magte-test na?
pwedeng mag-test.
It would be better. Kailan ka magte-test would actually, really the ideal part is if you monitor for symptoms, if you become symptomatic, you test. So if you really have plans to go out, the best thing to do actually is to make sure that yung event mo will have ways to maintain social distancing.
Correct.
Tapos, you make sure that it's open air, so mataas yung air exchange. So, kasi if you're gonna eat, wala kayong PPE. So, you have to make sure that there is enough distance between the two of you and there's enough ventilation to protect you and to protect the other person.
Yun nga yun eh. Di ba yung parang sense of responsibility for each other. And then yun din, let's say, umalis si Clark. Pinayagan siya ng daddy niya, which is nag-iisip pa kung papayag. Pag uwi ba niya, is it safe to say na you have to quarantine first for 14 days para to be sure lang. Kulong ka sa kwarto, di ba? Or either wag ka umuwi. Doon ka mag-quarantine sa garahe ng 14 days.
Vince,
Yes.
tanong ko
Yes.
mukhang hindi yata quarantine ang tawag doon. Grounded.
Grounded ka. Kasi,
dito.
di ba? So, yun ba? Kasi yun nga eh. You have to sacrifice. Kasi gusto mo malis, pero kulong ka ng 14 days. You cannot do anything, di ba? Yun nga, may trade-off yan eh. Di ba? Kasi you have to protect also the people around you, di ba, sa bahay. So, tama bang gano'n? If in case na labas si Clark, quarantine ng 14 days, walang symptoms, then swab. Di ba? Is it safe to say after 14 days ba, safe na lahat? Ganun ba yun?
Please monitor for symptoms. Stay isolated if you really have to go out, and so that you would not expose the high-risk people in your home.
Yes. Kasi
pwede bang iksian yun? Pwede ba iksian, Doc, yung 14 days? Pwede ba?
1 week.
1 week or 5 days lang?
Hindi. Kung ayaw nyo ng 14 days, 2 weeks na lang. Mas may na lang.
2 weeks na lang. Sige,
Dalawa lang.
Pwede. Di ba? Kasi ako nga, 21 days para to be sure. Kasi ako talaga, praning akong tatay. Di ba? Hindi mo alam na, you'll never know eh. Di ba?
Pero ano lang yan? Sorry.
Yes, Doc?
For critical patients na nasa hospital, yung mga naka-oxygen,
Yeah.
require them to do the 21 days. So
Yes,
instead of 14 days.
So, pang severe na talaga yung 21 days.
So, severe yung daddy mo na praning. So, 21 days ka.
Pero ako, nung nagkaroon ako ng 28 days ko eh. Although,
Very good.
sa 21 days pa lang, nakapagpa-test na ako. Nag-negative na ako. Nagdagdag pa ako ng another 7 days.
Just to be safe.
Pero it does not solve my problem. Kasi, Doc, merong aakyat ng ligaw.
Problema mo talaga yung maniligaw.
Pero yung siyempre i-interviewin mo muna yung anak mo. Yan bang manliligaw mo ay hindi lumalabas ng bahay? Yan bang manliligaw mo walang exposure? Papayagan ko yan na magkita kayo provided na wala siyang exposure at saka safe siya na pupunta sa bahay. Ngayon kung hindi, ang sinasabi ko kasi sa kanya, kung nahawa ka niya, bata ka pa, kayang-kaya mo yan. Pero pag ikaw, hinawahan mo ako, yun ang malaking problema. Di ba?
Correct. Yeah.
Oo.
Yes,
Tama.
Hindi naman mag-guarantee yun na yung kita sa'yo is hindi exposed or hindi lumalabas. It can
And mga athlete pa yung anak ni Sir Jordan. So, di ba, pwede nilang ma-withstand yung wala silang symptom eh. They can be asymptomatic.
Hindi,
diba?
you know how kids are. Halimbawa, makikita kayo ng manliligaw mo o boyfriend mo or friend mo, halimbawa. Ikaw ba, kakayanin mo ba na habang magkasama kayo all throughout, naka-mask ka, naka-face shield ka, tapos
diba?
wala kayong close contact, wala kayong holding of hands, wala kayong close talk, hindi kayo, kung kakain kayo, hindi ba kayo maghuhubad ng mask? Yung mga ganon. Kasi yung risk nun, na parang ka nagpapapasok ng intruder na may daladalang sakit. Di ba? Yun ang nakakatakot kasi.
Yes. I agree. Ano, Doc, masasabi mo doon?
At saka syempre, I think mananaig dyan yung ano ba yung pinaka-objective niya. So baka, you know,
pwedeng isatabi muna, di ba? Parang next time na lang.
Kasi yung role kasi, I think it's a basic rule for the family na, anak, huwag kang magpaligaw online, huwag kang magpaligaw sa labas. Kung yung lalaki na yan, talagang ginagalang ka, nire-respeto ka, bakit sa bahay para maligaw?
Paano na?
Diba?
Paano
Ngayon yun.
Too normal
kasalanan mo pala
May
suggestion ako, Tito J. Ang suggestion ko, bago pumasok yung kung aakit ng ligaw, yung manliligaw ng anak mo, kausapin mo muna online. Tapos, pasagutin mo muna ng mga disclosures. And then, sabihin mo, ikaw mismo magpapaswab. Ikaw mismo magkukuha ng samples niya. Ito, may papagamit ako sa iyo. Ito sabi mo, isasaksak mo sa ilong mo.
Sige, pwede ka maligaw. Ito, isuswap ko sa iyo.
Ito, sa ilong,
Lahat ng butas na lang.
Doon mo masusubukan ang katapatan ng lalaki.
Katapangan at katapatan.
Diba talaga siyang manligaw?
Kidding aside, Doc, malaking problema yan sa napakaraming pamilya ngayon. Problema talaga siya.
Yung stress level ng dads, and the kids, di ba?
Paano magpapaliwanag sa kanila na, anak, wag na muna. Pero 7 months na po, Papa eh.
Diba? Totoo naman din.
Tagal, di ba?
Mahirap din naman.
Challenge
and then meron din silang reasoning na yung Papa po niya, parang papa nyo din. So, maingat din sila. So, hindi rin sila basta-basta lumalabas. Yung mga ganong storya. Pero ang tanong dun, mapagkakatiwalaan mo ba yung ganong storya?
Yun nga.
Hindi, tsaka paano pupunta daan sa inyo? Anong sasakyan? May sariling sasakyan?
Hindi, magdadrive. May sariling sasakyan. May sariling kotse.
Paano magpapagasolina yun?
Yun nga yung on the way there, baka, di ba, you never know. Yung pala, Doc, balikan ko
you never can tell, sabi.
Yes, balikan ko yung na-mention mo na, dito kasi meron nako-confuse ako, yung viral load na tinatawag. Yung ewan ko kung, correct me if I'm wrong, yung viral load ba na tinatawag is, ma-infect ako ng one time, tatamaan ako, or dapat maraming beses siya? Ganun ba yung viral load na sinasabi?
Okay. Viral load is the amount of virus that you have in the body. If you get it. So, tinitignan natin yung mahirap, hindi tayo gumagawa ng viral load dito sa Pilipinas. We're able to identify positive or negative using the PCR.
Okay.
Pero meron silang mga pag-aaral abroad wherein they look into kung saan yung period na mataas yung virus sa katawan. No? It's usually that the first 2 days before you get the symptoms and the initial first 5 days. Actually, after 8 days, what they saw was most of patients with COVID will not have any viable or buhay na virus anymore. So
after 8 days?
Yeah. So after yung 14 days duration that we make sure na naka-quarantine sila, for most patients, more than enough na siya. So, dati kasi ang ginagawa natin, na-admit sila nung March, pagka-uwi, mag-quarantine pa uli ng 14 days. Ngayon, ilang na lang namin magmula sa umpisa ng kailan sila nagkasakit. So, yun na yung 14 days.
So, talagang one contact, pwede kang talagang tamaan na. One droplet, pwede siyang, it's not the frequency, it's the,
Doc, how about the lingering symptoms? Kasi, we've read some articles na, after you've survived COVID, but there are still yung mga lingering symptoms din.
Tama. Doc, hindi naman para, kasi sa akin, wala na, negative na ako, pero 1 month ako na matindi hika ako. Tapos, even after that pa, more than a month, hanggang ngayon, nararamdaman ko pa yung fatigue.
Yeah, that's actually what they're saying. Now that we've been able to follow up our COVID patients, that is what we see in our patients, regardless of if it was a mild infection or a severe infection. Even those patients with mild symptoms will have lingering symptoms. No? Hindi pare-pareho, Pero meron ang nagko-complain. It's different from the other viral infections that we were used to before, no? Like dengue, influenza, no? Mas mabilis mag-bounce back yung mga pasyente. Ito ngayon, we do see that na matagal, negative na sila, wala na masyadong overt symptoms, but they feel shortness of breath, or minsan hindi pa rin makaamoy ng 100%, hindi pa rin makalasa ng 100%. So that's not uncommon actually.
So how serious po ba are these lingering symptoms? I mean, is it something that we have to like worry? Is it worrisome?
Okay.
Or is it just gonna go away eventually?
Most will go away eventually. So that's one thing. Pero you do need to make sure that you follow up with your doctor. So what we do recommend, especially for patients na nag-pneumonia, we recommend a repeat chest x-ray at least 2 months after the whole event, just to see if it has come back to normal. Kasi hindi naman expected na pagkatapos ng infection, normal na kaagad. Your lungs needs time to fully recover. So usually that's what we request. We request a follow-up for our patients and an x-ray after 2 to 3 months.
Doc, meron pa po ako isa pong ito medyo mas serious din to na after effect. Pero kasi ito, napag-usapan po namin to minsan ng mga naging kabatch ko nung high school na nasa States ngayon. Doctor sila doon. Tapos yung isa doon, sabi nila that merong research in the area, I think in Chicago yata yon, somewhere mid. Ang lumalabas daw is that there's a chance then of survivors developing myocarditis. So ang ibig ko po sabihin is ano po yung may suggestion ba o meron kayong inaano na kasi siyempre kung pwedeng may chance of myocarditis is that extraneous activities after getting well medyo kailangan bawasan or something like that.
Usually when what we found out was myocarditis is actually parang inflammation of your heart muscles, no. We do see it in patients with severe or critical COVID. So for us to diagnose it, we do some tests which includes an ultrasound of the heart or a 2D echo. But normally it would happen during the critical period. So yun yung more common na presentation niya. For complications after COVID, it's mostly yung thrombotic events, yung tinatawag nilang parang naging sobrang malapot yung dugo.
Opo, yes, opo.
So we do a risk assessment for our patients habang naka-admit sila usually sa hospital kung wala silang contraindications, meaning wala naman hindi bawal na bigyan ng gamot para maging malabnaw, or we call it antithrombotics, to prevent yung mga ganong complications. And then for a special group of patients na high risk, pag uwi nila, binibigyan pa rin namin ng medicine for a period of time. Depende kung, parang case to case siya. Depende.
Pero nangyayari po yan sa mga critical patients.
Yeah.
So, ako, hindi naman sa do I have to worry about that? No.
When did you get sick ba?
August.
So,
well, practically the whole month of August po. Although I got tested August 24, release 25th na nag-negative na ako. Apo.
Okay. So meaning September, October, at the end of October, I would recommend that you do get an x-ray just to see your baseline. And then, in terms of symptoms, parang okay ka na naman ngayon, tama ba? Or
meron lang, Doc, na parang sa
utak.
tamaan,
sa utak. Parang utak.
May tama.
May tama, iba eh. Umakit yung virus.
Naapektuhan yung
utak. Saka yung tumubo yung mo?
Yung bird.
Yung bird. Okay.
Sorry, Doc.
Regular activities mo, kaya mo na. Wala nang, hindi na siya affected, yung regular activities.
Minsan, merong mga episodes po na hinihingal ako. Yun, may mga ganon. Pero not as often as nung first few weeks of September.
Okay.
Yung ubo ko nga, 'di ba, nagme-meeting tayo dati, Vince. Inuubo-ubo pa ako, 'di ba?
Yes.
So ngayon medyo okay na.
Wala
Binigyan din ako actually ng may batchmate din ako na pulmonologist. Binigyan niya rin ako ng steroids, yung turbohaler na with some steroids. So yun, medyo yun malaking tulong sa akin.
If I may seriously add something. Ang kagandahan lang ng discussions natin ngayon, meron na tayo ngayong BFF na infectious disease.
Yes. Benchmark na tayo.
Yung mga nagkaroon ako libreng consultant.
Yan.
After
And
2
yung mga binabanggit naman ni Doc ng mga services, yung mga pwedeng gawin ng hospital niya na puntahan tayo or teleconference.
Pwede pala yun, Doc?
Yes.
Pwede. Yeah.
Yun.
May home service kayo ng RT-PCR, Doc?
Yeah. We actually offer home service na laboratory tests including PCR testing.
That's good.
Yes.
Pati X-ray yan, Doc? Pati X-ray?
Oh God, that one, I think laboratory tests.
Endoscopy. Home service.
Doc, meron ba akong pwedeng suggestion dyan? Pwede ba siyang gawin? I know that your hospital has a parang Innova na sasakyan for such. Pwede bang yun ang gamitin? Wag naman yung ambulansya. Kasi alam mo yung mga subdivisions, pag ambulansya na yung pumasok.
Yeah.
Medyo
paranoid
mabigat
sila.
Correct.
I think meron yung hospital nyo ng parang high-is or Innova na hindi naman ambulansya.
It's a suggestion, yeah.
Anong hospital po ba kayo, Doc? If you don't mind me asking, ano po hospital ninyo?
Nasa De Los Santos.
Sa E. Rodriguez.
Correct, yeah.
Oh, nice.
Sige, Doc.
Pwede ka sunduin talaga ng De Los Santos. Huwag ka lang sunduin ng St. Peter. Delikado.
Yun lang, magkaiba lang. Pag yun ang sumundo sa'yo, iba na. Sige, Doc, tuloy mo, Doc. Ano pa yung mga pwede natin?
Other services.
Yes.
Yeah.
Na lab test.
We also offer physical rehab or rehab therapy.
Okay.
So, the doctor can go see you, assess what you need, and then yung follow-up rehab therapy can also be done.
Rehab on what? For
Rehab for
any?
For any post-stroke patient, post-mortem back, those who have difficulty ambulating. Kunwari na hip ka, kailangan
Oo. Lalo na ngayon, tama, sakto, Doc. Kasi ngayon, di ba, uso yung home gym, home training. Iba, mali yun.
Yeah.
Pwede rin yan for sports rehab. Parang,
Yeah.
that's good. That's good.
It's one thing.
Okay.
Maganda yung maganda yung rehab facility nila sa De Los Santos Medical Center.
Yes,
It's one of the best that I've seen in the country. Ano pa ba? Ano pa mga lab tests like blood test, CBC, pwede ganyan. ABC, EFG.
Neurotest baka kailangan na.
Primo, neurotest. That's good, That's good, Sige. We'll post the number of De Los Santos and di ba? Here.
Yeah.
Services.
And
Correct.
wag naman yung personal number mo pa, Doc. Pero at least, we will look for you at De Los Santos. Yung medical center ba yun, di ba?
Yes.
May yung medical arts building, di ba? So, nandun lang kayo. Doon nga pala ako nagpapacheck dati na nagkaroon ako ng problema sa panga.
Ano nangyari sa panga?
Sa panga?
Panga. Ngipin pala yun sa ngipin.
Kala ko, sinapakan ni Anet.
Kasabang sipa.
Sobrang dami nating natutunan.
Thank you, Doc. Thank you.
Ang laking bagay.
Sobrang daming questions before na hindi natin masagot. But si Doc,
the good thing about this, at least ngayon, talaga nag-a-adapt na, I mean, the positive thing is, thank you God, na bumababa na yung counts ng infected. And yung health system natin is
improving.
Diba? Improving, which is good. Pero,
Doc,
yung labas pa rin is limited.
Basta careful, Doc. Basta careful.
Doc, may isa pa pala.
Face mask.
May isa pa pala akong tanong, Doc. Kasi syempre, you are working for a hospital, di ba?
Yeah.
May mga nagkaka-COVID kasi tungkol doon sa quarantine, no? Yung home quarantine. May nagkaka-COVID na gusto mag-home quarantine. Meron nagsasabi na, huwag kang magpapa-ospital. Katulad doon nangyari sa akin, nagka-home quarantine lang din ako. Kasi then, at that time, no August, first week of August, yun yung medyo kasagsagan din talaga ulit, di ba? Yun yung nag-boost talaga ulit yung numbers eh. punuan talaga. Tapos pati yung mga screening nila, punuan lang din. So ngayon at least, bumababa na yung numbers. And I think, pati yung mga number of hospital beds, medyo nagki-clear na. No?
Marami
Hindi na
ng
siya ganun marami ng
Yeah.
vacancies. However, meron pa
Good
rin
news.
talaga na may mga pasyente nagkakaroon ng COVID, nagpa-positive, natakot pa rin magpa-hospital. So what do you suggest, Doc?
What's
Kailan
your
sila
advice?
dapat, what's your advice? Kailan sila magpapa-hospital o kailan pwede ang home quarantine? Kasi kahit ako, gumaling siguro ako, fine, sabihin ko, pero can I suggest that? Na kung ano yung ginawa ko sa sarili ko, can I suggest that to others? Na, hindi, mag-home quarantine ka na lang, di ba? Ako, hindi ko masasuggest talaga yon eh. Pero sinasabi ko, ito yung ginawa ko, ito yung nangyari sa akin. However, siguro mas maganda, magpatingin ka pa rin sa doktor. Yun ang sa akin.
Yeah.
But
So, ang tanong mo, ano
coming
yung
from,
threshold? Ano
yes,
yung threshold? Yeah.
coming from an infectious disease doctor, ano po ang suggestion nyo? Tama po si Tito J. Ano yung threshold na kailangan, okay, pwede ka pa dito sa bahay, o kailangan, dapat pumasok ka na sa ospital.
Yeah.
So, for mild to moderate cases, that means may COVID ka, pwedeng may lagnat, pwedeng may pneumonia, pero hindi ka nang re-require ng oxygen. Actually, home isolation and treatment can be possible if you have the facilities for it. No?
Okay.
I think it's also case to case kasi may mga ibang municipalities that they don't allow home quarantine.
Home quarantine.
Pero as long as you have, I mean, from a medical standpoint, if it's mild or moderate, it can be treated at home. As long as you have the facilities and access to healthcare. So meron kang doktor na pwede kang tignan or pwedeng mag-teleconsult. At least ma-inform ka kung ano yung mga pwede mong inumin, ano yung mga bawal, paano makaiwas na mahawa yung mga kasama mo sa house. Pero once you are oxygen requiring, it is really important that you are in the hospital.
Yan, Doc, nasa likod ko yung oxygen tank. Kaya sabi ko, hindi ako makapunta sa hospital, nagdala na ako ng oxygen. So, Doc, dahil nasabi ninyo po, kasi nagkaroon po ng, sabi niyo, may mga municipalities, may local government units, na ayaw nila, hindi pa pwede na nasa home ka lang, di ba? It's because of community transmission.
Yes.
So, paano natin po ma-avoid, na ma-prevent, or yung community transmissions? And what are the yung mga modes of transmission that you can say na it's a community transmission?
Well, so community transmission meaning you get infected because someone in your community is infected, no? So if someone is positive already, if they will do home quarantine, they have to make sure that their own facility is safe enough na meron siyang sariling kwarto na separate from the rest of the household, may sarili siyang restroom, and he doesn't really, dapat hindi talaga siya lalabas ng kwarto niya. No? So yun yung pinaka-importante. If you remember, the best way to prevent transmission is social distancing. So that's the caveat nung kung bakit ka naka-quarantine.
Correct.
Pero ang nakikita kasi namin, pag there are some patients who would force or who would assume that they can do home quarantine, pero iisa lang yung kwarto sa bahay, tapos apat sila.
Yun nga.
Yun yung mga things na yung challenge ng government natin, yun yung ayaw nila. So I know that there are some municipalities that would check your house to see
talaga?
home quarantine. Yes.
May ganun nga. May ganun pati dito sa Quezon City, may ganun barangays din.
That's good.
Yeah.
Diba?
And then
so,
you a quarantine facility if hindi pwede yung bahay.
Mga affiliate ng mga government.
That's true. Yeah. I think that's one of the successful formulas para talaga hindi magkalat yung COVID. And of course, we don't want to take too much of the time of our special guest tonight.
Oh so, my God. Sobrang thankful kami.
Salamat, Doc.
Salamat. Pwede ko ba kunin yung number mo rin, Doc?
Pwede.
Kasi tingin ko hindi pa siya tapos yung kasi meron ding effect na yung parang kang pagod lagi.
After effect ba yun?
Antok. Yung nakalagay doon sa listahan.
Oo.
Parang laging inaantok. Sabi ko, after effect din pala yun. Akala ko nagiging batugan na ako, parang gano'n.
Pwede maging advantage yan eh. Kasi pwede mo sabihin palagi yung excuse na, ano ba to, meron na naman ako COVID yan, tayo to.
Kaya kailangan ko nga si Doktora Hufano dahil kailangan kong humingi rin ng advice and magpa-consult.
Yeah.
Okay lang, kunin ko number mo, Doc, ha?
Yes.
Pa-Viber na ano na lang.
Yes.
Importante din yung aftercare kasi.
Yes.
Correct. Yun.
Yeah.
So that will be the
with
next
that
step.
Siguro, we can ask our BFF doctor to give final words.
Yes,
to our
please.
viewers.
Yes, Doc. Thank you very
Final
much.
words, Doc.
So let's not forget to always protect ourselves and to protect our loved ones. So the best way to do that is to make sure we wear the appropriate PPE. So in the community setting, you make sure you always wear your face mask. That alone would help you, would protect you, and in effect, if you make sure that you use it properly, you protect your loved ones.
Correct.
So hopefully, this will end soon.
Hopefully.
And we'll all be able to.
Yes.
Sana.
And palakpakan natin ulit ang ating frontliners.
Salamat, Doc. Salamat. Our mga bagong bayani.
Salamat. Dahil sa inyo. Nilabutan ako, nagkaroon ng time, nag-noise barrage kami doon sa buong building namin. Tapos katapat namin, nag-noise barrage din for frontliners like you.
Thank
you very much.
Salamat,
Nakakilabot.
Thank you.
Thank you for sacrifice and service. Salamat po.
Once again, thank you very much.
Thank you, Doc.
Dr. Hufano. See you.
Salamat.
Bye-bye.
Take care. Because we care, Doc.
Yes. Salamat po, Doc.
you.
Bye.
Bye.
Okay.
All right. So that concludes our podcast recording for tonight.
Bye-bye. Yeah,
Doc,
okay na po.
Thank you very much.
Thank you
Thank you
po.
po. Okay, so good. So yun, wrap up for episode 3. Salamat, Doc Hufano again. And salamat for the team. Sige, paalam na tayo isa-isa.
Yes.
So, Sir Jordan, paalam ka na.
Well, marami tayong natutunan from
Correct.
our special guest ngayong gabi. Baka nga magka-part 2 pa yan eh. But of course, I'd like to thank everybody and to our listeners. Sana marami kayong natutunan. Thank you.
Yeah. And kung meron kayong questions, leave lang sa comments. And then if you want certain or particular topic na gusto nyong ma-discuss, then just leave comment.
Correct. Primo.
Yun, salamat na marami kay Dr. Hufano. Ang dami nating natutunan ngayon, lalo-lalo na napagdaanan ko yun eh. So, mas marami na akong naiintindihan sa mga nangyari sa akin at nangyayari pa rin sa akin.
Yeah.
Kaya salamat na marami din. And kung may mga questions kayo, magtanong kayo. Huwag kayong mag-atubiling magtanong. Mag-iwan ng message. So,
Correct.
sasagot naman kami.
Yes.
Basta, alam namin yung sagot.
Yeah.
Huwag lang mat.
Wag lang mat.
Ikaw, Clark.
So for everyone, thank you for listening. Sa lahat ng mga gustong lumabas, katulad ko, wag muna, test muna.
Sinabi mo yan, ha?
Yes.
Sinabi mo yan.
Thank you.
Sinabi mo yan.
Sabi nga ni Kim Chu, bawal lumabas. So
that's being responsible. Salamat. And sa akin naman, salamat. And one more, again, di ba? We're not professionals. We're not well-versed experts.
Yeah.
So we're just sharing experiences, di ba? That's why we have guests na tulad ni Doktora. Salamat, Doc. And yun nga, stay hopeful. Malalagpasan din natin ito, guys. And salamat for, di ba, taking time to watch us and spread the word.
yes.
Love and revenge. Alright?
Love and revenge.
Week ulit.
Revengers.
Bye.
Till next episode. Thanks, guys. Bye.
Thank you.
Happy weekend.